Hello and welcome to the most recent episode of the Ultimate Wellness Group Transformation Sunday. I'm sorry, Transformation Tuesday, that's what I'm thinking. Got a wonderful show for you today. We're going to deal with a little bit of sad news of Kobe's death and what we all can do to start to work on our ability to deal with grief, loss, death, pain. How do we boost the positive hormones in the body? That's going to be in the mainstream minute. And then we're going to do, for today's show, is the prostate health. So please share the show. Please share the show. Please share the show. Make sure you send this to as many men as you can. Send this to as many people as you can that know are married, have boyfriends, fiancés, single men, whatever the case may be. This is the type of show that men need to hear. As I have said to you all before, this is my 25th year of practicing medicine, and one thing that I know for sure is that black men have an endemic idea that they don't need to go to the doctor, that they don't need to worry about their health, that they're going to be all right. And unfortunately, that causes a lot of pain on a lot, on a lot of families as they get older, because you're not doing the things that would help you take care of your health so that you would have a little better health as you age. So we're going to get into all that today. There are a lot of myths, a lot of misconceptions, as well as just straight up lies about prostate, and they're going to clear all those up. I'm very, very extremely capable, because this was something, of course, as being a black man, very near and dear to me, but also because it was my senior project when I finished my residency program, and I did extensive research into this topic. So I am an expert when it comes to prostate health. So without any further from me, I'd like to ask God to give us the peace of mind, the open mind to gather information and have the spirit to use it. And I also ask for myself to be freed of the animal or the beast of self-ego and arrogance, and may I be a vessel for your benefit. Khalid, I thank you for coming in, brother. Peace. So let's get right into the show. I don't want to waste any time, because Shirley X, thank you for coming in. The prostate is going to take some time, so I want to get this mainstream minute, and I want to get into the subject. So the first subject for today is I wanted to just briefly talk about my experience. Carl Brown, thank you for coming in. I typically am not a news person. I hardly ever watch the news. I don't pay attention to the news. I have my own way of getting current events and things that are necessary for me to know. Lawrence, thank you for coming in. Everybody, please do me a favor and share the show with as many people as you can, especially some black men, please. But so I was at my mom's house after Kobe perished, and I'm out here in California. Raphael and Larisha, thank you for coming in. And the story was going on all day, from 11 o'clock that morning until late in the evening. I actually went just to visit my mom and just to spend a little time with her. But of course, she and the rest of my family were so interested in this story. My niece, Kobe was her idol when she was coming up. My brother used to work at the Staples Center, so he knew Kobe. So it was kind of, something that I didn't want to interrupt. They were watching it. They was part of that. And so I said, you know what, I'm going to sit here. I'm going to watch this stuff on television like I typically don't do. And matter of fact, the last time that I was inundated in some so-called star's death was last year when Nipsey Hussle died. Now, I didn't watch any news, but I did a lot of social media information, because I was a Nipsey Hussle. I don't ever call myself a fan, because I'm not a fanatic of any person, but I listened to Nipsey's music for years before he died. And, I went on social media and I just started reading a lot of things about him, because I didn't know some of the things that I was reading. Shaniqua, thank you for coming in. And so that was my way of processing. I was like, man, I don't like the way this guy died. I really enjoyed his music. I enjoyed the things that he was doing in the community. I actually had plans on meeting him and working with him. But all that to be said, when he died, it did kind of affect me. Kobe, I was never really a big fan of his. I appreciated his tenacity and his killer instinct and all those type of things, but I really was never a big Kobe fan. And so I was sitting there watching the news and watching my family and thinking about how it was affecting me. And I was realizing that this is very, very, very abnormal. Number one, for us to be so consumed with a person that we don't know personally, that's a product of the media. Number two, why is it that we don't get this involved in this consumed with people that we know, or somebody that got killed down the street, or somebody that killed in your city, or on your block, or somewhere close to you, but we don't get involved like that. And so I just started to think about a lot of these abnormal things, and just thought that I would like to give some information on what we can do when we find ourselves in these type of situations. What we want to do is boost our serotonin and our dopamine. Those are our feel-good hormones. And the endorphins are the ones that actually help with pain, and they also are feel-good as well. And so I thought I would, I did something on Instagram, but I thought I would just do a little something. It shows a hug. Being around people that you love, laughing and smiling brings them good. The other thing that I talked about was going outside and putting your feet on the ground. That is something that I do often when I work out. I call it just a brief Reiki therapy. I put my hand, and I can, if you all are interested, let me know. I will put the link in. Just like a 7 or 8 minute video after my workout. Sometimes while I'm at the park, I'll take off my shoes, take off my socks, put them on the ground, put them on the grass, and just go through these steps where you just touch and do a few, basically connecting your mind to your chakras and improving the communication through the body. And this is something that boosts my spirit, gives me an overall feeling of calm. And so it's something that I think that people that find themselves highly affected by these deaths, that's just one thing. There are plenty of other things we can do. If that's something that you all want me to cover, we can do that, because I think it's important for us to continue to think about our mental health. And of course, mental health, a lot of times we think about them crazy people, but all of us have some mental health issues because of this warped and this demonic society that we live in. And so I just wanted to give that information. I hope that helps you all. Just a few things that you can do: eating the right foods, the things that we always talk about, getting some exercise, getting out, getting that sunshine, getting out and interacting with people in a positive way, doing things that boost the benefits to your body, all boost these positive hormones in the human body, and they have the tendency to overcome the negative ones. And that's the great thing about it. A lot of times when we start feeling bad, we feel bad for long periods of time, and that's the benefit of doing these. They actually will eliminate the feeling bad hormones and make you basically have like a high. And so that's what it, to me, is so wonderful about just having this little bit of information. Okay, so next, real quick in the media, I just wanted to touch base on this story again. I know you all may have been following it on some information sites. Coronavirus, crown-like spikes give the virus family its name. Here's what it looks like. So the average person has done no microbiology studying. I'm not really sure why somebody would want to. Darlene Pasley, thank you for coming in. Yes, we all need that sunshine. We got to get that food that gives us vitamin D. We have to go out in that sunshine and get it activated. And that is actually right on time, Darlene, because that is the type of thing that would make you not have to worry about a coronavirus. Now, think about this. Indigenous people around the world have been interacting with animals as long as we've been on the planet, because God made us, and then he made animals to interact with us and for us to interact with them. Coronavirus is a virus that typically affects animals, and now they're saying that these 100 people have died, and now it's in 16 other countries. So as I said before, 100 people just in China is so insignificant, it's not even worth spreading around and causing all this hype and this media frenzy and this fear that they're putting in people, but it's being done. So the things that you can do is continue to take care of yourself, get that exercise, drink your water, hydrate, eat the right type of foods that are going to boost your immune system. But I just want to go through this for a little bit. Common cold, pneumonia, these are the type of issues that you can get with just regular viruses. So at this point, again, as I said before, there really shouldn't be this type of media frenzy to make people afraid. But there's a reason behind this thing. They call it the coronavirus because of the way it looks under a microscope. That's really not anything that most people would even be considered. And then you see the kind of like a little funny thing. They're talking about this people associated with Corona beer. But anyway, I just wanted to mention that and just remind us that, most of the time when you see this type of stuff on television, when you see this type of stuff on the news, it really is insignificant to you unless you allow them to put you in fear. And then you go back and you're looking at it every day and you're wondering, is it coming to America? These are the type of things that mentally drain you and cause you so much stress that would increase your chances of getting infections. Stress will deplete and decrease the ability of your immune system. So my suggestion is not that you don't pay attention to the news, but make sure you continue to do the things to make you confident that that's not going to worry, bother, or infect you. Because I'm here to tell you all that the way that I take care of myself every day, and I attempt to take care of myself every day, I could care less when the coronavirus comes or where I travel and the coronavirus is. I don't believe it's going to infect me because my immune system is that capable. And you can be and have that same type of confidence. So let's get into the show for today, which is about the prostate. So let's start with a little anatomy. Wanted you all just to kind of see. I'm going to use my pen as a little pointer. I'm going to show another picture in a second. It may make it a little more. So this would be your rectum, where your stool sits before you go to the bathroom. This on top of it is the bladder. That is your pelvic bone, and this would represent the tissues of the penis for a man and the prostate gland. So as you can see from an anatomical perspective, it's not necessarily an easy place for us to be able to assess it. And here is somewhat of a more increased view of it, right? And that would be the posterior section of it, the anterior section of it. That's the bladder on top. And so let me go to what it looks like when we're actually doing an exam, all right? Now this is, of course, the dreaded exam that most men say, oh, I don't want anybody to put their finger in my butt. Well, I always used to tell men, D. Kiki, thank you for coming in. I always used to tell men, it would be better for me to have my finger in your rectum for a few seconds than you to have something going on that's going to kill you in a few years. But what I need to say, I will say about this rectal exam in a little bit, because there's a lot of information that we have to make sure that everybody understands, because men need to know these things, but usually wives, girlfriends, fiancés are dealing with men when they do these type of things anyway, because a lot of times men need that support and they're in fear, but a lot of times men are so afraid they don't do the necessary research they need to. So anyway, I just wanted to show this picture to show that when we put our finger in a rectum of a man and we fill in a prostate, we are looking at the posterior aspect. This is called the medial aspect, and this is the anterior. When we do a rectal exam and fill in the prostate, we're filling on the posterior aspect of it. Most of the cancer starts in the anterior. Just one caveat. But just again, look at the anatomy. We're filling on the prostate because we can't get to it from the bottom because the penis and the testicles are under there. Can't get to it from the front because of the pubic bone. And you can't get it superiorly, meaning coming from the top, because of the bladder. And so this is the only way that we can really have any type of assessment of the prostate gland physically. And so that's where this prostate exam comes from, with us putting our finger into a man's rectum. So I just wanted you all to see kind of the anatomy of the body and why we do it from that perspective. Now, Um, one of the things that we always have to consider is where did this idea come from and why are we doing those things? And the thing that I want all of you to leave here with is that anytime you ever have any type of exam when you go to any doctor, prior to you going to see this doctor, I'm talking about a blood test, a physical test, an x-ray, a mammogram, a colonoscopy, any test, it does not make a difference. You have to prepare yourself before you go to that doctor. What do I mean? If you come to me and I'm your physician and you say I need a prostate exam, I'm going to start asking you questions to see how you have educated yourself. Because there's a lot of misinformation out there, and hopefully by the end of this program, you all will not be miseducated anymore. But I'm talking about the typical man that goes to the doctor, and the doctor is going to put his finger in your rectum and check your prostate, but you have not even considered what's going to happen if I do have cancer? What's going to happen if my prostate is large? What's going to happen if my prostate is normal? What's going to happen if he takes the blood test? If it's high, normal, or low, what am I going to do? There should be a plan that we have before we go to a doctor. So number one, that you never can be taken by surprise. And then number two, you have the ability to understand what the doctor is talking about, where he's coming from, and make sure that he's thorough. You pay doctors. Your insurance pays doctors. So if you are not satisfied, you haven't gotten your questions answered, that doctor shouldn't be leaving the room. And if he does leave the room and doesn't answer your questions, the first thing that you should do is contact your insurance company and say you were not satisfied, you did not get treated correctly, and so he shouldn't get paid. That's your right. But most of us don't read the fine print in those insurance documents, right? Tina Carter, thank you for coming in. You say we have to do the research and support and encourage them. Absolutely. Because there's so many tricks that are being played. By the time I finish this program today, you all are going to understand why I'm talking like this, okay? So make sure you do your research. Make sure you have an understanding of what it is that you go into the doctor for. Maria Muhammad, thank you for coming in. So next is the PSA, all right? Everybody's heard about the PSA. Oh, go to the doctor, get your PSA checked. Well, the issue about the PSA is it is so non-specific, it doesn't have any direct correlation to anything. As you can see right here, it says enlarged prostate. That can increase your PSA. This is prostatitis. What is that? Is an infection that can be sexually transmitted. It doesn't have to be sexually transmitted. It could just be a bacterial infection that causes prostatitis. That can make your PSA go up. When it comes to sexual activity, Jeffrey, thank you for coming in. When it comes to, Jeffrey says, is the rectum exam the only test? Danny, thank you for coming in, bro. Yes, the rectum exam is the only test where we can feel it. But again, I'm going to get into the rest of what this PSA and all these other things that people are talking about, so I'm going to get to that in just a minute. And Dare, thank you for coming in. You say 4.0 PSA. Tell me what you mean by that. Recent ejaculation. So sexual activity, if a man is sexually active and you get a prostate exam right after being sexually active, your PSA is going to be high. If we do an exam like I just finished showing, your PSA is going to be high because we're pressing on a prostate exam. And the thing that most people don't know and most doctors don't consider is the fact that if you drive long distance, if you ride bikes, if you sit on things where there's something bumping or pushing up against your prostate, your PSA is going to be high. So here it is that a man could drive across the country, go to his doctor, get a PSA test as high. You wind up getting tests done that had nothing to do with the reality other than the fact that you were sitting in a seat and it was bouncing on your prostate, or you rode a bicycle, or you did some type of work in the gym and got one of those seats that are like a bicycle, and you caused some pressure against your prostate, and now you got a doctor that's going to do tests on you that aren't even relative to a problem. It's relative to your activity, and you're going to wind up having some tests and maybe even some procedures done that aren't even necessary. Victor, he's in the house. This is the man who asked me the question and wanted me to do this show. So thank you, Victor, and I appreciate you coming in, bro. So those are some of the things that can cause a PSA to go high. And so when a person says, I'm going to take a PSA test, you now have the ability to say to your doctor, you know what? I've been sexually active with my wife for the last 3 days. Maybe it's not a good time. I just finished driving for whatever. It might not be a good time. Great question, Dan. You say, what age should black men start to get checked? I'm actually going to deal with that in a minute because a lot of the information that's out here is very inconsistent with the truth. But the answer typically is 40 years old. Men should start getting their prostate checked. And if you have a father or brothers that have had prostate cancer or any type of prostate problems, you should start doing it probably in your mid-30s. Okay, so just real quick, I just wanted to show these statistics. I don't like putting a lot of negativity in us, but I just wanted us to see the new estimated cases of prostate cancer and prostate cancer deaths. So it is a problem. The question is it a problem in black men like they say it is? And so here are the statistics for black males. Daryl Muhammad said my PSA was at 4. Okay, I'm going to get to that in just a minute. All right, so here we have a statement. 1 in 6 African American men will develop prostate cancer in his lifetime. Overall, African American men are 1.8 times more likely to be diagnosed with and 2.2 times more likely to die from prostate cancer than white men. Now, a lot of you are like inundated with this type of information because as long as I have known about prostate problems, there's always black men tied to prostate problems. And I want you all to know, because I see a lot of black men on here today, this is an absolute bold-faced lie. There has never been a test, never been a study that has proved that black men get more prostate cancer, worse prostate cancer, or die from it more faster than white men. Never been a study. Now, as a black man, of course, this is very near and dear to me, all right? So as I was going through my residency program and hearing all these negative things about prostate, had a lot of black men patients with prostate problems. And so I want to be very clear. I am not saying that prostate problems, prostate cancer, all of these issues are not common in black men. They are very common in black men. But there has never been a study to prove those statistics that I just pointed out to you. So let me just give you all a little background. There have been, I think, 2 major and a few small studies done about black men and prostate cancer. And when you do a study in any type of a problem, the study has to be done very carefully in a very strict manner. You have to do everything in the right way. So the largest study that's ever been done for black men was done in Columbia, at Yale University. And they got a grant, got a bunch of money. They went and bought vans. They went and picked out a housing complex that had a lot of black men in it. They started bringing these black men in, doing the tests, figuring out how they're going to do the follow-ups, all this kind of stuff. In the middle of the funding, they lost their grant. They lost their money. And they changed so many things. They changed the place where they were going to get men. They changed so many different people in the whole program. At that point, this study was null and void. It has no capability to come with any conclusion that makes any sense. But yet they finished the study, and these are the type of conclusions that they made. Black men get cancer at a younger age. Black men's cancer is more aggressive. Black men die faster than other races of men. And the study never proved any of this. None of these things have been proved. So we have literally, as doctors, been given information that's based on lies. And then not long after that, I went to our CME classes, continuing medical education, where we go and we listen to these doctors act as if they're experts and they tell us this and that and this and that. So I went to this program, and one of the top urologists in the country was there. He was speaking. He said some similar things. And after the program was over, I went up to him and I said, "Sir, I have done extensive research on all the studies, and there's not a study that has ever said that black men have a higher incidence or more aggressive or that we die earlier." He looked at me and he said, "I agree, you're right." Turned around and walked away from me because he didn't want to have a conversation with me because he was lying and he knew he was lying. But guess what? When I looked at our book and it showed the companies that he was getting paid from, he was getting paid from 2 of the top pharmacy companies in the country. So this man was making a lot of money in order to walk around the country and tell people that as a black man you have an increased incidence of prostate cancer. So it was a lie. He knew it was a lie. He knew the studies didn't support what he was saying, but because he was getting paid and because he's making a lot of money and because the pharmaceutical companies were making a lot of money, he was willing to continue to talk that kind of madness. And so I just want to tell a real quick, brief story so that you all are knowing, so you all will know who you're dealing with. This is not to pat me on the back. This is not anything to try to promote myself. Zena Hayes, thank you for coming in. Carl Brown, I see what you're saying. I'm going to get to that in a little bit. But when I was in residency program, a man came to speak to us one day. We used to have these lunch meetings where they would bring us food, and there would be a guest speaker that would come and speak. Most of the time it was from a pharmaceutical company, and they were trying to propaganda us into certain type of medications. But on this day, this guy came in. He was doing some talk. I don't even know what the talk was about. But in the middle of the program, he mentioned that peanut butter was founded by Nabisco. And so my initial reaction was to raise my hand and interrupt him in the middle of his program and tell him that he didn't know what he was talking about, yada, yada, yada. But I decided to wait until the end, so I explained to him. I said, sir, your statement about Nabisco founding peanut butter is not true. A man named George Washington Carver founded peanut butter. In the middle while I'm talking, there's this white woman that was in the program with me that turned to me and said, oh, Keely, shut up. We don't want to hear that black talk. And excuse my French, but I said, bitch, don't you ever interrupt a black man when he's talking. I was so angry, not at the man who made a mistake, but at her for telling me to shut up in the middle while I'm trying to correct somebody based on history, our history. And so after this happened, they brought us all into a room. They wanted me to apologize to her. I said, I will not apologize to her. Why don't you have her apologize to me? It became a big problem. This is at UT Houston, right here in the Texas Medical Center. So then it became a problem with all the residents. Then the residents started asking, well, if you're in the emergency room with her at night and we have a patient come in, are you going to be able to work with her? I was like, man, y'all are crazy to think that just because I wouldn't let anybody disrespect my race of people, that I don't have the ability to remove that and help people. And then it went further. The whole department, they tried to kick me out of my residency program because of what I said to her, but never even addressed the fact that she was disrespectful and told me to shut up. So I'm saying this because I've always stood up for us, and I'm going to always stand up for us. I'm so thankful that God has given me this type of spirit. So when I come on here and I do these type of programs, I'm not talking out of conjecture. I'm not talking of what I think. I'm talking about years and years and years of research, years and years and years of interacting with people and getting the truth. And I will leave, if you all are interested, let me know, because there is a radio program, a blog talk radio program that I listened to just today. It happened, I think, a couple of weeks ago, where the man who actually invented the PSA test says that it can't do what people are saying it's supposed to do. So this whole prostate thing is mostly lies and money. The PSA test is $1 trillion business. Yes, I said trillion, not billions, trillion. So the PSA test is making companies more money than the actual medications. So don't believe that you're going to get truth out here on the internet. Don't believe that you're going to get truth from most of your doctors, because they're not willing to put their behinds on the line for you all like I am. Again, this is not pat me on the back. This is just the type of person that you're dealing with. I'm willing to go out here and ask people questions to their faces and go and delve into the information and get the type of information that can help my people first. I'm a doctor that will help anybody, but my people are first. And since prostate and prostate issues are so tied to black people, I'm here to dispel that myth and tell all you black men, all you black women, all you black people, stop letting these people kill your mind, because that's the first aspect of having your body deteriorate, is that your mind is affected. I am not saying that the way some of you don't take care of yourselves, some of the foods that you eat and some of the things that you do that are not the best for your health, you might wind up with a prostate problem. But if you're listening to my programs and you're working on improving yourself, prostate problem is not something that you should be worried about. And I'm going to talk about the solutions in a minute. Danny says, what is the main contributing factor? What is the main contributing factor for this condition? Yes, we'll get that in just a minute. Thank you for the question. Bahia Muhammad, thank you for coming in. So let me get back to a couple of things on here, and then we will go to Brother Danny and Carl Brown's questions, because they are very good questions. So, Farrakhan, thank you for coming in. So the reality of a prostate is that, and let me go back to a picture of it. If you look at that picture right here, this back here I said is the rectum, right? And this is your bladder. So that is a muscle. The bladder is a muscle. It expands and then pushes the urine out. This back here is the muscles of the intestines. That's the large intestines. So to a little degree, this depiction of the prostate is not accurate. The prostate is more of a fatty organ. It's not as fatty as like the endocrine organs that I showed a couple of weeks ago, but it is more fatty. It has some harder consistency to it, but it is not muscular. This is kind of a depiction of more of a muscular type reality. But the prostate is more of a fatty type organ. So what happens when you eat meat? What happens when you eat foods that have a lot of fat in it, but there are a lot of toxins associated with it, like chips and a whole bunch of these hydrogenated snack foods, like sweets and cookies and all this stuff that people eat for breakfast, like what else things called toast. You know, what they put the like the bready stuff in it, and you got the jelly and stuff in the middle. You put them in the oven and get them hot. I can't even think of the name of it right now. But at the end of the day, when you eat foods, especially fatty foods, and they have a lot of toxins associated with it, that affects the prostate. Now, a lot of people will say that a prostate problem starts to occur at 40, and that, Danny, was your question about what age. But those of us who are trying to take care of our bodies in a better way, those of us who become vegetarians and do vegetarianism the right way, which a couple of weeks ago I did a program on optimal vegetarian Pop-Tarts. That's what I'm trying to. Thank you, Ingrid. And thank you for coming in. Carl Brown, thank you as well. Maxine said it too. Pop-Tarts, yeah, those terrible things. And then, of course, they got other companies that have different names of them. Those Pop-Tarts are the type of foods that have a lot of hydrogenated oils in them and a lot of toxins. So when you eat that kind of stuff, it's going to affect all of your body. And the prostate is one of those things that it affects as well. Now, what is the purpose of a prostate? The purpose of the prostate gland is to make a fluid that travels and takes the sperm on the travel to wherever it's going, which should be in a woman's vagina, right? So a man makes his sperm in his testes, and they travel in this tube right here called the seminal vesicle, and they sit in this little thing right here, and I can't even think of the name of this right now, but anyway, that's where the sperm sit. When a man is getting aroused and his penis is erect, some of the sperm come out of this organ and they go down into the prostate, and the prostate does what? Produces the fluid that makes it travel. So when a man ejaculates, that fluid that comes out is from the prostate gland. The sperm you can't see, but the fluid is coming from the prostate gland. So that's how important the prostate gland is. It's majorly important with reproduction. And so when you have a problem with the prostate, look at the problems that can occur. This bladder, when you empty your bladder and you urinate, you're urinating through the prostate. If you have defecation coming up, it's passing by the prostate. When you have a need to get your sperm out, if your prostate is enlarged, it's going to decrease. That little tube right there is where where the sperm empties out into the prostate so that it can travel out during an ejaculation. Okay, so I hope that makes sense. What can happen in the prostate, and then we want to talk about some of the symptoms that can happen when your prostate starts to get enlarged. Now, the most common problem with the prostate is a problem that we call benign prostatic hyperplasia. It's when the prostate enlarges, and let me go back to the picture so that you all can see exactly what I'm talking about. So when you look at that prostate right there, in most men, it is the size of an acorn, usually about the size of an acorn, meaning that it can fit inside your fist, right? And then, as we get older, they say that this is starting to grow. I don't believe it's just with age. I believe it's with age and improper taking care of the body. Because I've known a lot of men in their 40s and 50s with prostate problems change their lifestyle, start doing things a lot better, and their prostate shrink back to normal. I've had plenty of men over my career that have had early stages of the precursor to cancer and reverse it with the proper lifestyle. So no, I don't believe that the prostate just gets abnormal because of age. I believe the prostate gets abnormal because of things that we do. And at the end of the day, I believe everybody on here that's listening to me would agree that why would a God make something go bad just because you get old? So when we put God back first in our lives and we make God first, then we have to think through things like God would think through things. God would never make your body go bad just because you age, but he does make your body go bad when you don't treat it right. So that's my philosophy. So again, if you have the three different things that can cause an abnormal PSA test, one is what we just said, right? Poking your finger on it, riding a bike when the seat is going to be sitting right here under you, bounce up and down, whether it's a car seat, a truck seat, a bike seat, something that you're working out in the gym, pushing up against that prostate can cause it to go high. Your, like I said before, an infection, whether it's sexually transmitted disease or not, can cause an infection of your prostate. Benign prostatic hyperplasia is when the prostate starts to grow because things are irritating it, but it's not cancer. So as it grows, it can't go that way against the bone. It can't go that way against the bladder. It can't go this way because it can actually go that way, but it's going to cause, as you can see, some pressure on the urethra. It can cause some stenosis on the urethra coming through the prostate from the bladder, and it can cause constipation problems because it can cause a problem into your rectum. So this prostate gland with all these different organs and different systems around it can cause a lot of symptoms when it starts to grow. And then of course the most significant aspect of it growing is that you have cancer in it, and then the cancer can spread to some of the surrounding areas. So if you have these type of issues where you have a prostate problem, whether it's prostatitis, inflammation of your prostate, swelling of your prostate, whether it's benign prostatic hyperplasia or it's cancer, these are the type of things that you can start to have problems with. So these are the type of things that men should be doing yourself on an everyday basis. When you go to the bathroom, you should be trying to figure out, okay, what is my stream like? What is my stream like now compared to when I was 20, when I was 19? A feeling of an incomplete bladder. Do you go to the bathroom and you go and you sit down and you lay back in the bed, you're like, dang, I feel like I go right back to the bathroom. Because you didn't completely empty it all the way. Sometimes it could be because, like I just finished saying, that if this is blocked, or if the prostate is enlarging and going down in this way, you're blocking the urethra, you get some urine out, but it still might be half full. It still might be mostly full. I've had men where this bladder can get as big as a doggone, like a 1 liter bottle. That's a huge bladder. Most of us only have about 30, 40 cc's in here. And so just to make it relative, to have a whole liter, this bladder would be way up here. Bladder's not supposed to be that big. And we're going to talk about how it's related to the kidneys in just a second. Let me see. Danny Muhammad, good question. Let me see. Daryl said, I eat broccoli and cabbage that you recommend I drive 18-wheelers, so that may cause the yo-yo effect on my PSA. Yes, absolutely, brother Daryl. I'm going to come back to that in a minute, because the foods that you're talking about, we're going to talk in a minute. And I'm also going to talk about what drivers need to be doing and people that do those type of workouts, riding bikes and all those type of things. Danny says, can those listed symptoms of prostate be corrected? If so, how? Yes, I'm going to talk about that in a minute. Osasogi Edigen, I hope I said your name correctly. Thanks for coming in. Then he says, is there another condition, stress, that may mimic symptoms of enlarged prostate? Okay, let's get to that. So let me go back to these symptoms. Difficulty starting your urination. That makes sense. If we go back and look at that prostate, if the prostate gets big, you can't even get the urine out. So yes, sometimes I know men that have to push real hard before they even get started, and sometimes that doesn't even help. Frequent urination. That can happen with prostatitis and other problems because sometimes the prostate being abnormal can irritate the bladder and make it want to empty all the time. Urgency to urinate. So you have this urgency, and when you go to the bathroom, nothing comes out. Getting up frequently at night. That can be a prostate problem. It can be diabetes. Urinate stream that starts and stops. So in the middle of while you're urinating, everything seems fine, it just stops. Straining urinate, meaning you got to push. And then sometimes a man can go to the bathroom, he can urinate, and then he goes back and starts doing it. He got to come back and urinate again because of the prostate and its position again, right? You can see how all of those symptoms that I just finished talking about could be possible if this is large because of the way that everything kind of goes, right? Now, real quick, and I'm going to get to these questions because there's some very good questions. I just wanted to point out, number one, this is extremely wrong. A woman's uterus is not up there. I guess they did it just to kind of show the difference between man and woman. What a woman's uterus is in front of the bladder, like down here. But anyway, the point of this is, coming from the same perspective that we just finished talking about, you see the prostate and you see the urethra coming from the bladder going towards the penis so it can be eliminated, right? If we start to develop a problem where urine is backing up in your bladder because you can't release it correctly, then you're eventually going to start causing some flow back up into the kidney, and you can literally cause kidney problems with a prostate problem because the bladder is not able to empty, the kidney is not able to empty correctly, and you start getting a backup of all the symptoms. So having a serious problem with your prostate can eventually cause kidney problems, and most of the time when that happens, we're talking about very, very serious and very long-standing problems. Time to heal. Now, to the questions about solutions, we're going to get to the food in a minute, but the same way that it takes time for this prostate to grow and cause a problem, you can cause the reverse. You have to believe it. You have to get to work. You have to be able to do the things. And so, as I said, men, all of you should be trying to do this type of a check every time you go to the bathroom. You should be asking yourself these type of questions. Is my urinary stream changing? Do I have to push to get it out? How long does it take me to urinate and get everything out compared to when I was 20? Do I have to get up at nighttime? Do I have these type of problems? And then if you have these type of problems, what does it do to your drinking water and your hydration program? Usually it causes men to start doing something different as far as drinking water and hydrating. So now you're going to dehydrate the body, which is going to make your prostate and other issues worse. So make sure that you all take a look at this, go on the internet and look this up yourself. Write it down, put it in your mind, whatever, and start evaluating yourself every day. Now, when it comes to solutions, you have to look at the prostate like every other part of the body. You all have heard, if you all have heard, some of you is the first time, but most of you who have heard me before, you've heard me say, Tawana, thank you for coming in, and Farrakhan says, I love the teaching, my brother. Well, thank you for coming in, and thank you for the compliment. If you've heard me speak before, you've heard me say that I think it's pretty ridiculous that we would cut our skin, right? Some of us shave and we cut ourselves, or we are working around or doing whatever around the house, and we cut or scrape ourselves and the skin heals. If that is true that the skin heals, why would God make the body so that the inside wouldn't heal? So the first thing that we have to do is realize that we do have healing capacity. And then when you have a strong mind and you come and you look at pictures like this of a prostate and you start thinking about your own prostate and then you start eating the right type of foods, you're telling the food to go and solve the problem. So what are the type of foods that, and what are the type of things that would help us heal the prostate? The first thing that any person should do if you have any type of a prostate problem is you have to start hydrating. And I know I just finished talking about the symptoms. And yes, I'm saying with the symptoms, you have to hydrate. because all organs in the human body have the ability to be cleansed, and they are cleansed by blood and water. And so if you have a problem with urination, you don't like going as often as you have to go, you don't like having to push, I understand that, but the solution is going through the problem. So you have to continue to drink enough water, you have to continue to hydrate, because the prostate gland has to be cleansed. The irritation that happens a lot of times when the prostate gland is starting to swell is because of bad diet, toxicity, and water and hydration is the way that you start to flush those things out. Richard Seven, thank you for coming in. Peace back. So the second thing is, if you have a prostate problem, the thing that has worked for me the most in patients over the years is you have to stop eating meat. And I want to understand, I want you all to understand, I'm not knocking people who eat meat, but what I tell people all the time is that your body is talking to you. The problem is that most of us don't have enough knowledge to understand what the body is telling us. So as a man, when you have prostate problems and you're a big meat eater, your body is telling you this meat is not good for me. Why am I saying that? Because many men that I've had over the years, I've either greatly decreased their meat or asked them to stop eating meat. And those are the men that I talked about earlier that had great success in reversing prostate problems. I've had men solve prostate cancer. I've had them solve the early aspect of when the prostate is going towards cancer and BPH. I've seen them solve all of those problems in my career by mostly decreasing the meat. And then the second thing that you have to do is you have to decrease, as I said earlier, the hydrogenated fats. You have to understand something. If you are trying to fix the brain, the thyroid gland, the adrenal glands, which sit on top of the kidneys, the prostate gland, the ovaries, the testes, these are organs that have fat in them. So when you eat something that has fat, where's the fat going? To the fatty areas of the body, because that's how you solve the problems. Gaddafi Simpson, thank you for coming in. When you have a problem with structures like your muscles and your tendons and your ligaments, where does that come from? Though that's built by amino acids. So when you eat something with protein or you eat something that has amino acids, that's where those amino acids are going, to those sections of the body to start taking care of problems. When you need to produce some new bone and keep your bone healthy, you got to eat things with calcium, right? All these things make sense. And so when you are eating foods that have high fat, and when you're eating food that have these bad fats, they are affecting your hormonal system. The prostate is not part of the hormonal system, but it's greatly tied to the hormonal system. And so you have to eliminate hydrogenated fats. I'm not saying eliminate fats. Fats are good for you if you're getting it from avocado, if you're getting it from olive oil, avocado oil, safflower oil. So those type of oils, if you use with your food, they go in the body and they do some benefit. But if you're eating canola oil, soybean oil, or hydrogenated oils like I've talked about, that's going to cause more irritation of your prostate and more irritation of the fatty organs in your body. Okay? The other thing that really has been shown over the years to improve the prostate are phytonutrients. And most of the time you'll hear people talk about specifically lycopene in red tomatoes. And that is, and what has been studied the most when it comes to prostate. And so yes, those are very good, but your phytonutrients in general. So please take some time, go back and listen to my last two shows, Optimal Vegetarianism and Meal Planning for Weight Loss and Health, because I talk about the phytonutrients, and I don't have time to go back through it today, but phytonutrients are the type of nutrients that come from plants that aren't specific to sugar, that aren't specific to amino acids, that aren't specific to fats. They're specific to the sugars that are specific to that particular fruit. And those go into the body and do a great, wonderful job of decreasing inflammation. One of the things that you can do to help your prostate is also putting turmeric in your food. And then, as Brother Darrell said, when it comes to things like high fibrous food, so you should be eating your bean soup as often as you can. Cabbage, Brussels sprouts. What else has a lot of fiber in it? Broccoli, cauliflower, asparagus, squash, eggplant, okra. All of these foods, very high amounts of fiber. You have to add heat to, because all those things I just mentioned are vegetables. You have to add heat to that in order to get rid of the anti-nutrients, the phytates the phytic acids and the oxalic acids. But those foods have a lot of fiber, and a lot of fiber will not only help eliminate from your colon and your rectum, but it also decreases the pressure that goes against your prostate, which is another irritating factor when you have prostate issues or any irritation to your prostate. Everybody that's asked questions, please let me know if I answered your question or if I didn't. So Victor says, so contrary to hydration helping to improve prostate issues, does drinking coffee and other caffeinated drinks contribute to prostate issues? That's an excellent question. I would say, based on my research, I don't know that there are any caffeine receptors in the prostate, but what drinking coffee usually does in a typical person is it dehydrates them. When you drink coffee, the caffeine stays in your system for usually for hours, and it depends on how much you drink. If you're the type of person that starts drinking early in the morning, you drink until afternoon or late in the morning, you probably have caffeine in your system most of the day. But if you're the type of person that takes a drink in the morning and then you hydrate and you move around, excuse me, after a few hours, you probably get that out. But it's going to depend on your activity and your hydration and how much water you drink. So that usually is the issue. But specifically to your question, when a person has a prostate problem, let's go back to the picture real quick. We're talking about an organ that is associated with a lot of fluid, right? It's right next to the bladder. It is the purpose of it is to make a fluid that helps travel, right? So we're talking about a very moist organ. All of the organs in the body are moist, but some are just a little more than others, especially the ones that are made to make fluid. So when you are dehydrated, you cause more irritation to your prostate. It'd be no different than, people that say, I'm going to use this certain lotion, or we should be using like shea butter and things of that nature, but people typically use lotion to so-called moisturize your skin, right? When your skin is not moisturized, you feel like it's rough. It's scraping and scratching up against stuff. Well, inside the body is the same way when you get dehydrated. The prostate is not made to be a dry organ. It's made to be a wet organ so that it can do the things that it needs to do, as well as the fact that when we're moving, the prostate is moving along with leg motions, all those type of things. So all that kind of stuff can irritate the prostate when it is not healthy. So again, y'all let me know if I answered your questions. I wanted to end with this. It is very known fact, as I mentioned a few minutes ago, how much money the medical industry is making off of the PSA test. And so you have to make sure that you own and take ownership of your health if you're going to get yourself checked. I'm not telling you not to get yourself checked. But as Daryl, who is a truck driver, you should never get your prostate checked a few days after getting out of that truck. If you're going to get your prostate checked, you should at least wait a week because of the type of massaging or the type of irritation, the type of pressure that is occurring on your prostate on a regular basis. Usually my workouts include bike riding. So I will ride my bike to the park or ride my bike to whatever area I work out. Then I do my workout and then I get on my bike and ride back to the house. So I wouldn't get my prostate checked unless I stopped doing that for a week or two. And so all of you have to do the same thing. That's why I'm saying for you men, first of all, I hope everybody shares the show. Send it to somebody that you know, or just share it so that men can watch it. But you have to have a diligent, dedicated program where you are paying attention to what is going on with your prostate, with your urination, with your penis, with your private pelvic area health. It is very important for you to understand all of those different urinary symptoms that we talked about, because at the end of the day, it's your responsibility. And I am here to tell you that most of you cannot trust the doctors that you go to. You think you can just off of whatever it is that you use to evaluate the person. But I'm here to tell you that most doctors don't ask questions. Most doctors don't know a lot of the information that I'm talking about today because they don't research outside of the mainstream media. Most doctors do what drug reps come in their offices and tell them to do. I never listen to no damn drug rep. The first thing I'm going to do if you hand me some medicine and start talking to me about it is I'm going to go right to that insert and start reading it. I think some of you have heard me tell this story before. When Prevacid first came out, the drug reps used to come to our offices and hand us all these pink boxes. This is the best medicine on the market for GERD and stomach problems, all this kind of stuff. I opened up the doggone thing while the doggone drug rep was standing there, started reading it. And I showed it to him. I said, man, your study has 70% white, I think it was 76% white males, 3 or 4% black people, 3 or 4% Mexicans, 2 or 3% Asians. After I finished reading it, I said, man, the only thing that you can tell me is that this works for white men. Period. There's nothing else that should come out of your mouth. But how many doctors actually challenge people like that for your benefit? Not many. Most of these doctors out here just go along to get along. They don't have time. They haven't organized their life and their practice around the ability to put you first. They got to put the money first. And that's why they don't have much time to see you when you come. I'm not trying to bash anybody. This is not a bash session. I'm just being honest with you and empowering you that if you don't start to take the time to empower yourself with your own health, you sometimes are putting your life into somebody's hands that really doesn't have the focus to put you first. They have the focus to put their practice and their house and the cars they drive and the type of lifestyle that they want to live and to make sure that their children have everything they want. That's what they put first. And then how many people do I need to see in order to make this a reality? I got to see a person every 5 minutes. I got to see a person every 7 minutes. That's the national average right now. Most doctors in any facility has 5 to 7 minutes to see you. Do you really believe that somebody can totally take you into consideration and really take your perspective in 5 to 7 minutes? I know for a fact that it don't, because most black people and most people, period, aren't taking care of themselves well enough to just go and just have a basic conversation. Sorry. It's just the truth. I'm passionate about it because I'm so tired of being tricked by people that have a focus on money. And that's what this whole PSA prostate problem is. Ishmael says, how important is it to get biopsies if you have been diagnosed with prostate cancer? Excellent question, and that's what I wanted to end with. The typical process is, and let me say what the typical process used to be, and then I'll come to now. The typical process used to be that we used to do this exam, right? This used to be the industry standard, is that we would stick our finger in there and feel it. If it felt normal, we didn't do anything. If it felt like there was a lump or one side was bigger or something was hard, then we would do a PSA. Now, what happened over the years is because of the concentration on money and not enough studies to prove anything, all of these systems that we've had in medicine have never been truly proven. They just are things that people suggest. Like I was saying, the dude that was supposedly the top urologist, he was all about the money. He was about getting paid from these pharmaceutical companies. So he's going to go with what they tell him to do. He's not going to do any study that's going to come out for your benefit. But the point that I'm getting to is that there never has been a very good system that we've come into as far as medicine and what we should do about your prostate. So my suggestion is that you do the things to improve your health. When it's time to go get your prostate checked, you should have a doctor do the exam, because filling your prostate is an aspect of the doctor taking into consideration what potential things could be. If you want to get a prostate exam checked and you want to get the blood test, get it done, because you will have a basis. But don't ever let anybody make a decision on your life based just on a number. It has to be taking everything into consideration. If you have somebody do a blood test on you, they should not come to you and tell you, I'm going to send you to a urologist, or I'm going to send you to do this exam, or I'm going to send you for this procedure, and they haven't checked, they haven't put their finger in your rectum. No. Don't ever let anybody send you off to another doctor, or send you off to a biopsy, or send you off to say you have this or that, when they haven't done enough things to give you a total picture. Now, if the urologist is going to do it, then okay, because that's the reality of medicine these days. Some primary care physicians are so busy, they're not going to do a prostate exam. They're going to send you to the urologist to do the prostate exam. But the point that I'm getting to, as Ishmael asked such a great question, is that you have to have a plan. My suggestion, what I would do with my body, have them check the prostate, or you can have them check the blood test. But if the blood test is high, the next thing that comes out of a doctor's mouth shouldn't be where I'm going to send you. It should be, I'm going to do a prostate exam to see what I can find in your prostate. Because the reality of what is happening with these PSA tests is like I just finished saying to you. If you're riding a bike 3 or 4 times a week for your exercise program, and then you go to a doctor and you get your PSA checked and it's 12, you're going to be sent to a doctor, a urologist. How do urologists make money? Biopsies and surgeries. Every specialist makes money by biopsies, procedures, or surgeries. Don't ever get it twisted. Specialists are about money. Nothing else but money. I'm not saying some of them don't care, but they make their living off of procedures and surgeries. So when you are sent to a urologist, they are going to take an aggressive perspective with you. So if your prostate is 12, your PSA test is 12, you've been riding bikes for the last 6 months, you don't think to say it, now you're in somebody's office getting biopsies of your prostate. And it was never anything other than you had some irritation to your prostate because of that bicycle riding. And I hope I'm making sense to you, brothers, on how you have to put yourself back in control. Now, if you get a PSA and your PSA is high, and somebody puts their finger in there and they feel your prostate and say, man, it's hard and it's big, there is a potential that is cancer. And so that is a potential that a biopsy is going to give you an answer, right? But think about what I just finished saying. Don't allow yourself to go and wind up there without doing your diligence of making sure that the information that you're getting should lead you to that doctor. Okay, so you have to make sure that you have not done anything to irritate your prostate, no sexual activity, at least a week. I would say the optimal situation would be 2 weeks before you go in there. Give your body a chance to get everything right. Now you're getting an accurate test. And once you get an accurate test, then you can start making decisions on the accurate test and not an abnormal test. Because all of you that are listening, whether you understand or not, if you ever are in a doctor's office and they tell you you have cancer, your whole life is going to change. Your countenance is going to change. Your confidence is going to change. I've done it. I've been there. I've had to give bad news. I've seen it. So don't belittle that. Please don't belittle that. If you have not had it happen to you, you don't know what it's like. It's no different than like what Kobe's wife is going through right now. Those of us that haven't lost a wife or a husband, we don't know what it's like to lose a spouse. Those of us who have not lost a child, we don't know what it's like to lose a child. And I'm telling you, it is destructive for a doctor to tell a person you have cancer. That is the worst thing that everybody is expecting. And it is so destructive to the mind. I have seen many people die right there on the table getting told you have cancer, dead. They didn't die right then. It took years for them to die, but they died on that table because some people can't come back from that. So prepare yourself and make sure that if anybody ever does say that to you, if you've prepared yourself for that information, then you already have some things going in your life and already doing some things that could catapult you into a positive mind state so that you can get back on track. I hope I'm making sense. Let's get to the last questions. Zena Hayes says, what causes UTI in males? Good question. The majority of the time what causes UTI in a male is a sexually transmitted disease, but if a man has any problems in these systems, he can get a UTI because, again, if a prostate is blacked up, the bladder is going to be holding on to urine. When we urinate, you're urinating out bacteria, we're urinating out toxins, and then waste from the water, waste from the blood. So sometimes you can have a prostate problem and bacteria stay in the bladder and it causes irritation, yes. So if your question is specifically about the prostate and UTI, that's what happens, right? As I said earlier, this is the tube, the urethra starts right there, and it goes out to eliminate a man going to the bathroom, right? And so if this is swollen and that urine can't travel through there and it's backed up in here, then that could be the potential of how you get a UTI. So quickly, you all let me know if I answered your questions. I think somebody that Daryl said the supplement prostavin. Yeah, I really get in prostate um, supplements and all those type of things, my brother. I believe that food is the best way. God first put food on the planet, you go foods. Foods that are the best for your prostate are the same ones that are best for the rest of the body. So if you're interested in that, please go back and check out the last two programs. The last one was food meal planning for health and weight loss, and I also did one a couple of weeks ago, about 3 weeks ago, on optimal vegetarianism. They both are on my YouTube. So I thank you all for coming in today. I pray that I've given you the type of information that can empower you, especially you men, but also you women that are going to be with the men. My experience in medicine, of course, after 25 years is that most men don't know, don't want to, or don't know how to be in present time to give the right type of information to a doctor. Rafiq, thank you for coming in. In my experience, if I have a man and a woman come in my office and they're older than 40, I always ask the woman first before I ask the man about himself. Because most of the time, your wives, your girlfriends, your fiancés are paying more attention to you than you pay attention to yourself. That's an unfortunate reality, because even though she is paying attention to you, that's not the best information. The best information is for you to pay attention to yourself, for you to understand when your body changes, how your body changes, and what is it doing to you. That's the best. That's always the best. But my reality is that men don't pay attention, and men justify things. Men rationalize things in a foolish way. It's that macho, oh, yeah, I'm gonna be all right. I don't need to go to the doctor. I'm cool. And then next thing you know, your black behind is in such horrible health that you're destroying your wife and your children, everybody else that wants to be a part of your life. Let's take more responsibility. Brothers, this is specifically for you. Everywhere I go in this country to speak, there are more sisters than brothers always. And most of the time, when men tell me why they didn't come, or men make these excuses of why men aren't there, it's so they working or they soldiering, they this and that. That's not a good excuse when you wind up in that damn hospital with a doctor that you can't trust. It ain't gonna do you no good then. Every single one of us have to take some time to prioritize our health. That is putting God first. You can't put God first and just disregard your health. God gave you your health. Prove him that you appreciate it is taking care of it. And so that's what I'm about. I'm about empowering, but I'm not about worrying about people's feelings when I talk. If your feelings are hurt, I didn't mean to hurt your feelings, but if your feelings are hurt because I'm telling the truth, then that's what's got to happen. Black men do not spend enough time concentrating and planning to have good health. In the name of, I'm working too hard, I'm this, I'm that, I'm too busy. Okay, well, you're going to be busy and die unless you change that perspective. You got to put some of your attention on your health. Most of my programs are full of women and hardly any men. So that's the reality. My 25 years of experience dictates what comes out of my mouth. Not anything else, not emotions, not trying to get mad at people, not trying to put down people, telling the truth. Tina Carter, thank you, ma'am. Ingrid said, thank you for some great information. Thank you for coming in. Danny, thank you, bro. So I pray that I gave you guys some information, some news that you can use. Please, everybody that hasn't subscribed to my YouTube channel, go to my YouTube channel so I can do these type of programs on YouTube as well. I am the Ultimate Wellness Group on YouTube, the Ultimate Wellness Group on Instagram, and of course the Ultimate Wellness Group here on Facebook. Thank you all for your attention. Thank you all for coming in, spending some of your time with me. Remember, your health is worth hard work, and it takes hard work in a society like this to have good health. So until next time, you all take good care of your health, and peace.